Diabetes mellitus is a medical condition that is caused by abnormal or elevated blood levels or sugar levels in which there's poor control, and it's a medical condition that requires treatment and management. And the reason being that it ends up causing damage to function of certain organs, and sexual function is one of the systems that may be affected, especially if the diabetes is poorly controlled. Sometimes erectile dysfunction might be the first presenting sign in someone who is diabetic, as they may not know their sugar levels. Sexual dysfunction encompasses a broad spectrum of conditions, but to break it down, there are basically three areas of sexual abnormalities: disorders to do with arousal, disorders to do with an erection that is enough for penetration for successful sexual intercourse, which we call erectile dysfunction. Then disorders of ejaculation, where one may fail to ejaculate or may not see ejaculation. Now, diabetes tends to affect all these categories. So one can lack arousal, one can have weak or poor erections, and one may have difficulties in ejaculation. However, amongst these three, lack of or poor erectile function is the commonest. It's important to note that if you are diabetic, you are 3 times chance of developing erectile dysfunction compared to your other fellow citizen who does not have diabetes. Therefore, sexual function becomes a topic of interest in every diabetic patient. Every diabetic patient should get an evaluation of their sexual function. What we know is that there is a bit of myth and mystery around sexual matters being discussed. Therefore, a lot of patients may not volunteer their lack or inability to achieve good sexual performance. Now, the end result is that obviously failure to or poor sexual performance is going to have a feedback effect on emotions, and patients may end up having depression, marital disharmony, and even separation of partners. Now, how does diabetes end up causing all these disorders? It can be broken down. The basic understanding is that the elevated sugar in the bloodstream tends to cause abnormalities of the nerves that carry messages when you get arousal. The blood that is supposed to flow to your male organ, and what may happen is that even if there is arousal, there may be no transmission of the messages to the male organ, and subsequently there will be poor blood flow to the male organ. Now, the nerves are the ones that carry the messages, and what we know is that in diabetics, the nerves are affected. They end up poorly conducting the messages. That's the first. The second, we know that diabetes damages the blood vessels that carries blood to the organ. So these blood vessels, they become stiff with time. They no longer relax to allow more blood to flow, and henceforth there's poor blood flow. Now, the other aspect of lack of arousal, it has to do with the issue of low testosterone, the male hormone that gives sexual desire. It's not unusual to find amongst diabetics that their testosterone levels are lower than normal. Ejaculation problems are explained by the weakness of the system that allows the valve that is supposed to close at ejaculation time. This valve is supposed to close so that the ejaculation does not mix with urine because when you ejaculate, you don't urinate at the same time. Because of that, this valve becomes incompetent or becomes weak, and it may open at the time of ejaculation. It is the responsibility of the practitioner in actual fact to do a sexual survey on every patient, because what we know, diabetes is a journey, and as the patient, the longer they have diabetes, the higher the chances they're going to develop erectile dysfunction. When they go for their assessment, as much as they go for cardiovascular or heart assessment, the same way they should have a sexual assessment. However, for a patient, if you are diabetic and you notice that your erections are getting weaker, then you should immediately get worried. It could be the diabetes. Now, it's important to note that this does not happen suddenly. It tends to be a gradual decline, and you tend to realize that the erection either does not last long, or there are disappointments during the act of sexual intercourse, resulting in failure to maintain, and resultantly there will be no ejaculation, of course. So any patient, if you're diabetic and you have erectile dysfunction, then you should see your practitioner for evaluation. The discovery of what we commonly call Viagra has revolutionized treatment of erectile dysfunction. And this group of drugs actually do help the patients. And how do they work? They simply improve the blood flow by making sure that your vessels that carry blood relax more so that more blood flows. However, they are not a cure. If you are diabetic and you have erectile dysfunction, where diabetes has caused the damage, your erectile dysfunction will improve on the tablets, but the moment you remove the tablets, you may notice a decline again. Therefore, the patient should expect or should be counseled that they're going to rely on these tablets to maintain good and satisfactory erections for sexual performance. However, also it's important to note that with progression of time, most of the times the diabetes ends up still causing more damage despite one receiving these drugs. Therefore, it's important to realize that these drugs may fail at a certain point in time. If they failed, usually that level requires a specialist, who happens to be a urologist, to do further assessment and evaluations. There are treatments that can be done, which ranges from injections directly into the penis. In worst case, you may have an artificial prosthesis being placed so that you have an erection. I should say that, however, no patient should suffer because there are options, and this can be discussed with the patient. They say prevention is better than cure, and I have said that once the erectile dysfunction is set in, it's not curable. Therefore, yes, prevention is very critical. It is very important to note that, of course, once you have been diagnosed with diabetes, perhaps you may not do much in taking that back, but the onus is on you to make sure that you have got better and tighter sugar controls, following the strict dietary advice, which is low in carbohydrate, which is low in salt, which is fairly high in protein and vegetables, is what is generally recommended. This is generally good for even overall health. So that's the first thing. Your diabetes should be under control. The second thing is that you should make sure that if you have other conditions that may cause erectile dysfunction or worsen, they should be attended to. So I will list them. Hypertension commonly is associated with diabetes. Therefore, your hypertension or high blood pressure should be well controlled. The next thing is that there should be lifestyle modification of certain habits. You should stop smoking. Every diabetic is told that, and for your sexual function, you should stop smoking. Cholesterol, your cholesterol levels, which is now a different disease entity from diabetes, but is also associated with diabetes, should be checked and should be managed. Now, we recommend a Mediterranean diet, which is just a diet that is based mainly more on fruits unprocessed, unrefined foods, and this centers on glycemic control. Now, also stress management. This, when it happens, it affects you, it affects your sexual partner. Now, if you do not have it addressed in a platform where there's an open discussion, it may be a problem where it reflects back to you, you lose confidence, you start getting performance anxiety, your erectile dysfunction actually worsens because you are now too anxious. You do not focus on performance, but rather you focus mainly on your past failures. And this is not good. Therefore, having a discussion which includes your partner is good. In brief, this may be quite important to help the management of your condition. My last words is that you should not suffer. Your sexual life should not suffer. Your partner should not suffer, because there is help out there. You should be open to discuss with it with your practitioner, and you should even suggest and participate in the management plan, because a good, healthy sexual life reflects on a good, healthy life and even sugar control.